Let's talk about, first of all, the curve. We're starting to see these numbers. And if we can bring that curve back up for our viewers, I just want to recap this because it's encouraging. And it's time, of course, for a bit of optimism, cautious optimism, as the Health Minister says. But I think it's fair to say that things are working to this point. Let's hope that continues, Mark.
All of these restrictions, of course, to give the virus effectively nowhere to go. It can only transmit between people if there's contact between people, sufficiently close contact between people for those droplets and infectious agents, the virus itself, to transfer to other people. And if you can have the sort of social distancing that we've seen instituted right across Australia and broadly very well observed by Australian citizens, it should be said, then you get this kind of result. And I think it's a credit to the medical authorities and the governments, both state and federal, for the energetic way they've gone about this, and indeed the Australian population for taking it seriously. Of course, there are some examples of that not being the case, and there have been some bungles as well, and there have been some probably periods where policy decisions could have been taken a bit earlier, but Australia is in a very good position compared to most other nations.
And that's the point, isn't it? Because we all see what's happening in the UK, the US, let alone Spain and Italy. And not only are we doing better than that, we're probably tracking closer to those nations that have been praised for their performance, like South Korea and Singapore.
Yeah, absolutely. And this is one of the features of this unique incident, really, that there's such a time lag between when someone picks up the infection and when they show symptoms, and therefore between when a particular lever of public policy is pulled and you get evidence of either it working or not working. And it's interesting that some people in the US, for example, and we've known this has been coming for a long time in the US, some people at health authorities there are now likening it to, a Pearl Harbour situation. Now, they're trying to obviously brace the population for significant uptick in deaths, and their death rate there is already, really extremely worrying. But of course, Pearl Harbour was a massive surprise. That's the whole point of the Pearl Harbour attack, is that it came out of nowhere. No one saw it coming. This has been seen coming for a long time, and it's a good example of what happens when you don't have governments actually acting, trying to get ahead of this thing. The Trump administration in particular was very tardy and disorganised. The health system there is a shambles compared to ours. The federal-state interface makes for all kinds of problems. The fact that so many people are outside any sort of healthcare, any sort of health insurance, a whole lot of reasons, interjurisdictional, interpolitical, and other things. In Australia, I think we can say we've done things. We don't want to pat ourselves on the back too quickly, because there's a long way to go, as we keep being told. But it's certainly encouraging.
Yeah, there is a long way to go. You're right, and that's a cautious optimism, I think, is the way to describe it, and to avoid complacency either at the government policymakers or just in the general population. I want to ask you about this $130 billion package, because it's one of the most important pieces of legislation we've seen through this parliament. The government and opposition returning this week to see the passage of that. And the Prime Minister, we've seen the news poll today, getting great support for being the leader in a crisis, and he's done very well with Josh Frydenberg. I think they've received appropriate praise for that package. However, we're seeing some anomalies with it. Would you hope, or at least expect them to make some tweaks to this? Because if you see companies laying off thousands of workers next week because they weren't willing to compromise, when you're spending $130 billion, surely that you do everything you can to avoid that.
Precisely. You want an awful lot of bang for an awful lot of bucks like that. And if it turns out that this hasn't been perfectly designed, and of course it's inevitable that it has not been perfectly designed. It's no reflection on the government and no criticism of the government that there are loopholes in this, that there are ways in which it can be tweaked and adjusted to match the real world. The whole reason you have parliaments, the whole reason you have public service even, and all of the machinery of government in the normal course of things is that ideas, legislation, new initiatives get worked out through time. There's a whole lot of filters that these things would normally go through before they become law. This has to be done very quickly, and so it needs everyone to be on board. But it doesn't mean that you simply announce something and then stick with it. So I think there's some legitimate pressure coming on the government. There's going to be this lightning second session of Parliament on Wednesday. You would hope that the spirit of the government here is to recognise what Australians have recognised them for, which is decisive action, but also wanting effective action and as effective use of that money as is possible. So you would hope the government is prepared to recognise those real-world situations.
And one of the examples, if you look at, say, Woolworths, a major company, $1 billion turnover plus, but the pubs that they own have shut like every other pub. So the government just treating those businesses with turnovers of upwards of $1 billion differently, I think is, as Tony Burke rightly put it, it's a blunt instrument. And you're talking about thousands of workers. It doesn't matter to them, really. I mean, if they're getting their pay packet from a company with $1 billion turnover or $800 million turnover, you would expect the worker to still get the same sort of treatment in the eyes of the government, wouldn't you, Mark?
You would, absolutely, and that is the egalitarian principle that this nation likes to tell itself is, in its DNA. And one can understand the way the government tries to put parameters around this, tries to put limits on it. But when you think about it, this arbitrary limit of companies with turnover of $1 billion or less are eligible and those above are not, it doesn't make sense, as you say, for someone who's employed by one of those companies or one of those subsidiary companies and who suddenly finds himself on the scrap heap. This is the trouble with those kinds of cut-offs. They need to be looked at in terms of what effect they have in the real world. It might look like a good way of containing the overall cost, and there is this argument that these very large companies have a lot of elasticity in their balance sheets and they can find other ways to do it. But as you say, if some of these companies start shedding significant number of their workforce as a result of there not being any way of keeping them in their judgment, it's no consolation to the people thrown on the scrap heap that the government had this particular arbitrary limit.
That's indeed well said, Mark Kenny. Thanks so much. Talk to you soon.